and would tell you how I would do it with waking hypnosis. So any of you who have particular specific problems, I wish you would tell me what they are now, and we will take time out for those questions. Anybody over here? I imagine, Doctor, in bronchoscopies, you would find waking hypnosis tremendously valuable, just as you have found the trance state to be so valuable. But you would be able to do it on many people even faster with waking hypnosis, because you don't even have to wait for the time to get the trance state, now that you know about waking hypnosis, Doctor.
Well, I wouldn't want to do that without them looking at me.
You wouldn't? All right, you want their eyes closed. Okay. All right, but don't unsell waking hypnosis for that reason, Doctor. You use your waking hypnosis, and you'll find it'll work so beautifully for you. Are there any questions that you would like to ask?
Well, we've been able to, we had an 82-year-old man the other day that with a carcinoma of the esophagus we couldn't give an anesthetic to, so I let the resident do his gastrostomy, and I just conditioned him at the head of the bed. Now it's major abdominal surgery.
I should say it is.
And we've done biopsies of the axilla and so forth. It scares the nurses a little bit when you don't pick up a Novocaine, just cut on somebody. Their eyes get very big.
Yeah. But since the patient doesn't even feel it anyhow, you've got perfect anesthesia, so what should you worry about?
But I would like to know, I guess that's a little bit ahead of the gun when people just keep on counting down to 5.
That's artificial somnambulism, Doctor, and we'll give you the solution to that at the next session. But I want you to work with those people, because I want you to learn artificial somnambulism as well as true somnambulism. And so when they don't lose the numbers, you can depend on it. It's artificial somnambulism. I want to stay on the subject of waking hypnosis, though, because I want to cover this and make sure that we've covered it. Any questions in your particular practice, Doctor, where you would like some information on how it could be handled hypnotically?
Yes, these children that know that they come in, that either know they're going to get a shot or know they're going to get something sewed up, and they're crying already. What can we do with them? They're already afraid.
Well, then, Doctor, let me just show you. I'll give you an awfully good answer to that. Is there anybody in this room who would like to have an area on their body anesthetized to a degree where from now on to the end of time, so far as you are concerned, you will never feel an injection again? You will never even know that you're getting an injection while it's being done. Anyone who dreads an injection terribly and would like to have a magic spot on their body? If you would, come on up. Those of you who didn't come up are going to be awfully sorry, because in giving the doctor the answer to his question, you're going to learn something now which is so fantastically good that you ask almost any student from last year how well they use the magic spot. I think it's used all over this area. Doctor, have you used the magic spot much? How do you like it? This magic spot is so amazing. Can you raise that sleeves high enough so that we can... Now here is the greatest advice for children. As far as that goes, it works on adults just as well as children, because I have an adult right here. In fact, mothers and fathers of these children afterwards, I don't know how we're going to do this on you unless we can raise that higher, because that's not high enough for an injection. I don't think so.
No, I can't put it down. Why couldn't you give it here, Mom?
Because I don't think that's where they would prefer it. Just slip it off your shoulder.
Here, I think I have it. I can't get this back down.
You can't get it back down. That shows you why we can't get it back up, huh?
I think maybe my shoulder.
The shoulder would be fine. That's fine. That's perfect. Now, I want you to watch how I do this. I want you to open your eyes wide, please. I'm going to pull your eyes shut. Now, all you have to do is to pretend that you can't open your eyes. And keep on pretending you can't open your eyes, so much so that when you try to open your eyes, they really won't open. Now, let me see you try to open them while you're pretending. That's right, that's right. Now, stay like that and keep on pretending you can't open your eyes. And the most amazing thing is going to happen. You're going to have a magic spot put on you. Once this magic spot is put on you, never again will you have to feel an injection. You'll know that the doctor's working there, but nothing will disturb, nothing will bother you. You'll never have any discomfort from an injection either before, during, or afterwards. Now, who is in the habit of giving a lot of injections because I want this injection given in the usual way that injections are given once I've given her the magic spot? Any of you who are in the habit of giving a lot of injections? All right. Now watch. I take this area and I paint a magic spot like that. Now, whenever an injection is given in that area, and she'll be able to point it out to the doctor, nothing will be felt there at all except that she'll know you're working there, but that's all. She will feel absolutely nothing. Now, doctor, to prove that, I want you to go in there and give an injection the way you would ordinarily give an injection, and you'll see she won't even feel when you're doing it or why you're doing it. The same area there. That's right. Now, isn't that beautiful? Now, when I have you open your eyes, you're going to be able to watch an injection being given and not even feel what the doctor is doing. All right, open your eyes. What did you feel?
I felt a little something, but it didn't hurt.
No. I want you to watch now. Do you want another needle, doctor, just in case? Give another.
Yeah.
Now, I want you to watch that he'll be working right there and you'll be unable to feel what he's doing. You can watch. What'd you feel?
Well, you know, not much.
That's right. That's right. All right. Just pressure, and that's all. You want this? All right.
Oh.
But you'll never have to worry. All right, that's going to stop bleeding now. That's bled enough, and it'll stop.
Did it stop?
Sure, it stopped.
It stopped?
Don't you look at it, and it'll stop if I tell it to. No, it'll stop completely. All right, now, don't look at it, will you? It stopped already. Okay. Just wipe off the residue and you'll find it.
I'm going to remember that
white
spot.
Sure.
That's going to come in handy, isn't it?
Now, she's all right. Put a fresh tissue there.
So they're going to pull your dress off. Yeah.
All right.
But the trouble I have, these kids...
Oh, look at that. We did soil you.
Oh, that's all right.
Sloppy.
That's all right. That's all
It's worth it. If you never have to feel an injection again, it's worth it, isn't it?
The trouble I have, they won't listen to you to start with. I mean,
All right, doctor, if they won't listen to you, then they've got to have the injection the hard way, doctor, and I know of no way. If I can promise a child, look, if I give you a magic spot so that you never have to feel an injection again, would you like that? And I'll tell you that our pediatricians, who are working with a tremendous number of children, that's all they do all day long, and they tell us that the magic spot is one of the most valuable things they know. Because the mothers of the kids and the fathers of the kids come in later and ask for magic spots. The following week, well, let Dr. Otis tell you, the following week the kid will come back and say, right there, doctor, right there. Is that correct, doctor? No. This is a combination of the trance state and waking hypnosis developed by Dr. Farrell of Cincinnati, the pediatrician in Cincinnati, who took some knowledge which I gave him, added to something that he thought of, which was the magic spot. And since then, we've been using the magic spot and teaching it to all our doctors because it has been so vastly successful. Yes?
You use the eye closure method.
You use the eye closure method to start.
You give the injection.
Yes, then let the child watch the next injections, and they'll be able to watch it, and they don't feel a thing, and they lose all their fear of an injection, and very proudly they say, right there, doctor, right there.
That's the next visit that you let them watch it.
No, doctor, you can let them see that they won't feel it right away. Or else you can say, if they haven't felt the first injection, which will oftentimes happen, you can say to them, now you saw I gave you the injection, you've already had it, and you didn't give me the, oh yes I did. There's what I gave it to you with, and you show it to them, and if you don't want to inject again, and say, and next time when you come here, you'll have that magic spot, and I'll always be able to use that magic spot, and you won't feel a thing. You ask any of the old students, and they'll tell you that the magic spot is magic. I mean, it just works so beautifully. I think that answers your question as much as I can answer it, because if you can't establish communication with the child, doctor, I am just as helpless as you are in that respect. I must be able to establish communication, or else my techniques are valueless. Now, I can establish communication very, very easily if given just a moment. But if you've got a crying, shrieking child where you just can't get through, where you can't even get through to say, I know a game, and use the top trick, I don't know what to do if you can't establish communication. Doctor, let's go right through the class and see if there's anybody who has any specific problems. Any specific problems? And this is your technique for it, doctor. You'll find that if you use this relaxing agent, they just automatically relax. And they have no control over it at all. Their critical factor is bypassed so completely that the relaxation occurs completely. You'll find that you've already got the answer to it. I beg pardon? I don't think so, doctor. You just go over the lower area, that's all. No, well, if you've got to make a stomach examination, doctor, that's a different thing. But if you've got to make an internal examination, and that's what I was talking about, you'll find that this will work. Now, if you want to make a stomach examination,
the abdominal muscles must be relaxed.
They will be. They will be. You use this technique, and you'll find that they will be. Or if you find by any chance that a muscle or two is not completely relaxed as you want, just say in about 10 seconds that relaxing agent will reach that area, and even those muscles will relax. And it'll reach that area, and those muscles will relax. Any questions which you might like to? What is that?
Can you use hypnosis to overcome stage fright?
Oh, yes, yes. I don't think there's any performer in the world but what uses autosuggestion to overcome stage fright. You have to use it practically. Because that little excitement before the program begins, I don't think, I've been in show business, as you know, all my lifetime. I've never known a time when I didn't have it just prior to making an entrance. That is, making the first entrance of the evening, I mean. Then after that...
How would you approach something?
Well,
An eye closure first?
Yes, and just tell them that now you have such complete confidence that you know your lines, that you know just what you're going to say, that you know just what you're going to do, that when it comes close to the time for you to be able to give the performance, just close your eyes for a second or so, relax for about 2 seconds, and all that stage fright will disappear, and you'll be able to do the evening without any stage fright whatsoever.
Could you accomplish this with a little girl who had the needle in her arm?
Yes, why not?
She has. She's very good piano.
Uh-huh.
Cannot play.
Yeah, well, why not? Well, why not? You could do that very easily.
She's my wife. I have this problem, and I haven't attempted to do anything about it myself because she's never asked me.
Yeah, but you could relieve that stage fright completely. Waking hypnosis would do it, but the trance state would do it very, very easily. Get her in the trance state and tell her that just about a minute before she has to go on, she's to close her eyes for about 3 seconds, then open them, and all that stage fright will have vanished, and she'll be able to remember everything that she's supposed to do and everything that she's supposed to say, and she will be complete. She will have complete confidence in herself and in her ability to carry on the way she has practiced to do.
Can I ask you another?
Sure you can.
I'd like to know a few phrases which you can say in waking hypnosis that bypass the critical factor. Of course, we know the ones wanted to happen and it will happen.
No, you wouldn't use that. No, in waking hypnosis, you wouldn't use any of those things, Doctor.
What do you say then?
Oh, no, you just do what we did here.
But I mean, a complete stranger doesn't know.
Well, the complete stranger, you still say to the stranger, now, I'm going to anesthetize this area, I'm going to anesthetize this throat so that you don't feel a thing, and this little gadget that I have to put down your throat, you just won't mind it at all once we get this anesthesia in there.
And you can do that with pain, headaches, or whatnot?
Yeah, sure. Well, no, I wouldn't try to remove a headache by waking hypnosis, Doctor, although I've done it. But I don't, until you get more familiar with waking hypnosis, I wouldn't attempt it. Use the trance state for removing a headache.
If somebody returns to the office the next week or something like that.
Well, you could use waking hypnosis for that, of course, but I would use waking hypnosis the way I've indicated tonight, and then widen your uses of it as you go along and as you learn to use it more and more. But don't try to use it all at once to the detriment of the trance state. You know? In other words, don't use this as an instead of measure. Use this as another valuable tool that you have. It's just one more tool to give you as the course continues. Now, let's go through and find out if anybody else has any specific problems. How about you, Doctor?
You got a child infected here and you want to do a myringotomy. You do that with the
What is a myringotomy? I don't... Oh, yes.
How do you do that?
So just by anesthetizing the same way, telling them that now I'm going to swab that and it'll lose all feeling and you just won't feel anything that I'm doing. You'll know I'm working there, but won't bother you at all. You could do that. With a child, it might be advisable to retain the trance state, however. It might be more advisable to use the trance state on the child than the waking state. But you can use the waking state on those children on whom you cannot get the game of pretend. Sure you can.
Now, I'm not sure. You mean...
Eye closure and bypass of the critical factors, says trance.
Involve counting backwards.
Not with a child. Not with a child. Pretend you can't open your eyes and you've got it with a child. Doctor, do you have any questions?
Well, I was going to explore that same area a little further. I also have quite a few children that have both injuries or something like that. Send them home and play baseball or something of that nature has been working very nicely for me.
Mm-hmm.
But I wanted to ask, how much anesthesia do you achieve with a child in that particular circumstance?
In waking hypnosis, you mean? Or in what?
Where they can...
Where they pretend. You get the very same thing that you get with any adult. You get a very deep form of hypnosis. You get somnambulism. No, you just tell them, you've got to give the suggestion, now you won't feel anything. Now I'll be working there, but it won't bother you a bit. Those things you must get over. Any questions here, Doctor? You said you had a special problem about this metabolic readings. I beg your pardon? It's been answered. Do you have any special questions? Do you, Doctor?
I saw a patient with one of these acute back strains or kicks in the back with marked this over the sacroiliac joint.
Mm-hmm.
And not knowing what to do, I went ahead and treated it in a high-moderate manner, giving her a high pull.
Mm-hmm.
Could I have used some hypnotic suggestion
Oh, yes.
to relieve muscle spasms?
Oh, yes.
Couldn't even move.
Doctor, you know, it's a funny thing. We think that we only have control over certain muscles and certain organs of our body. As a matter of fact, God has given us control over much more of our body than we think. Why was it possible, for example, for me to say to that lady, now it'll stop bleeding? Because I knew that if she didn't look at that, it would stop bleeding, and she didn't look at it, and it stopped bleeding. But all she had to do was to turn around and look at it, and her own doubts caused that to bleed again, which meant that her mind unlocked. But the minute her mind locked around the idea that she could control that bleeding, it controlled, and she didn't bleed anymore. It's as simple as that. Now, I bet it hasn't bled one drop since has it? No, because of the fact that I locked your mind around an idea to which you were keenly receptive. Now, then you would have said that, now there's muscle spasm here. I'm going to teach you how to relax. I'm going to apply a relaxing agent. And I would have used a combination of trance state and waking hypnosis, both in that case. First, I would have gotten the trance state to let the patient feel the relaxation, because you can feel it better when you let yourself go into deep somnambulism. Once in deep somnambulism, I would have swabbed the area with some type of lubricant and say, I'm going to make sure that this area, particularly where the muscle spasm has occurred, that that area is relaxed. Now, you won't have to do a thing about this, but when I swab, just stay relaxed, and the relaxing agent will do the rest. And you would have locked the mind around the idea that that muscle was going to relax, and the inner control, which we exercise, like she exercises inner control over bleeding but doesn't know it, the inner control which we exercise over those interior muscles would have manifested itself, and the muscle spasm would have been relieved. I mean, it's as simple as that, Doctor, and there's such a nice explanation for it, that much as we think we know about the human body from our anatomy studies and other things, the anatomy study still doesn't let you look inside the human mind and see how the mind works, Doctor, and very little is known comparatively about the human mind. I've had men who have said to me that they believe that some illness is caused by emotion. I've had other doctors say to me a lot of illness is caused by emotion. But I have also had professors, men who are nationally honored for their knowledge and for their teachings and for their textbooks. And I've had these men say to me things that they've never dared to put into the textbooks. And one of the things that several of these men have said to me, that we believe all illness is caused by emotion, that the cause of all illness lies in the emotions. And I said, germ illnesses too, Doctor? I can't believe that. And they said, well, why is it that two people are exposed to the same germ? Both have the same blood pressure, both have the same tests, all the physical tests we know about. One person will come down with the illness, another person won't. Tests will reveal that the other person is just as susceptible to the illness as the person who came down with it. Why did he come down with it? There must have been something within the emotions to cause it, because we can't find the answer anyplace else. Now, I don't think they're ready to publish these findings or their own thoughts, because I don't think any doctor in the world would accept them. And I'm not sure that I would accept them from my standpoint, because I can go along with them and say certain illnesses are caused by emotions, and certain neurotic conditions are caused by emotions. In fact, all neurotic conditions are caused by emotions. I'll even go so far as to say that. But physical illness caused by emotions? And then a man like Caprio, who has been first and foremost to say it, says even cancer is caused by emotion. Caprio has said it, and Hutschnecker has said it in writing also. And Hutschnecker is very much respected. And so is Caprio very much respected. But to go along with them, I don't know that I could go along with all the men who think like that. But certainly it explains why we have control over bleeding, and we don't know that we have control over bleeding. Ask any old student, and he'll tell you, oh, I told him to bleed to the top of the socket and stop if he's in dentistry. Or he said, I told him that now they'll stop bleeding, and boom, they stop bleeding like that. Now we know that they would bleed very much more. I don't know the answers to all things, Doctor. I wish to God I did. I just know that we have much more control than we think we have on a lot of things. And that's what makes it possible for you to use suggestion in the manner indicated, and for you to get a perfect result. When you say to the patient, now I'm going to swab this area, and this area will relax, even more so than any other part of your body, that muscle spasm will disappear, and all the discomfort you have in that area will vanish. And almost instantaneously, you'll get results. Remember this, that with hypnosis you can never mask a symptom. You can alleviate a symptom, but you can never mask a symptom. And if there's any organic pathology revealed by that symptom, it will be alleviated and eased, but it will not disappear.
In other words, the ruptured disc would not be masked.
No, you could never. That's why I said that you couldn't mask a symptom. The patient would say, oh, my back feels a lot better, but it still hurts a little bit in there, doctor. You know, and then the next day or so it'd be hurting as much as ever. So you'd alleviate it but not mask it. Well, here's a man who's already used it on 4 cancer patients. he can't mask the cancer. They know they have pain, but he has certainly given them a lot of relief. Is that right, doctor? Yeah, not even taking aspirin. Is that a delight to hear? All right. Any other questions that anybody has? Let's go to the second row. I think I covered you, though. Any questions? Doctor in the third row. Got any problems there?
Sir, I work in the emergency room, and I was wondering about the drums coming in. And this also
You can hypnotize a drunk person, but he'll still be drunk. And you can get him rid of the shakes. You can get him rid of much of the DTs. You can bring the DTs to a conclusion a lot faster. You can do a lot of things with alcoholics. You can't get them to stop drinking. I wish you could. But you can help them a lot. In fact, we had a prison doctor. That is not a prison doctor, but a county jail doctor. He was a doctor at the county jail, and he told us that he had been able to remove the shakes from about 75 patients out of 100. And I myself have removed the shakes from a lot of people suffering from them. Been able to remove the DTs from some of them. But you can't cure the alcoholic craving by hypnosis. I know of no one. If they say that they can, doctor, it's from lack of knowledge. I will not claim a thing for hypnosis unless I know it can be done. If I know it can be done, then I'll tell the doctor in all sincerity, gentlemen, you can do this. But if I don't know it can be done, I would never, never, never say it can be done. And I've never known anybody to cure alcohol by hypnosis. But what we have been able to do for the drug addict, doctor, is to make the separation pains much easier to bear. Almost eliminate them entirely so that the patient can get over the craving for drugs without the separation pains, or the alcohol problem child who craves the alcohol. Using hypnosis, we can make the separation from the alcohol easier. But we cannot cure the love of drinking or the love of the drugs. Yes, doctor?
I was thinking one occasional problem patient by an OB who's in labor who has had no conditioning in the office and just arrive on the floor and they're within an hour of delivering and they've got a lot of sedation, Demerol, and they're yelling and moving around. They're really not too rational. Is there any approach you can use to a person like that, or is the sedation
some of our
down to where you can't reach them?
If the sedation is to the point where you cannot communicate, you cannot help them. But if you can still communicate with them, doctor, many of our OB/GYN men tell us that I've had men who have been students for 3 or 4 years say to me, there isn't a person who comes in for a delivery that we can't help to some degree at least, even if we catch them in active labor, even if we catch them when their contractions are 30 seconds apart, we can still help them.
You have to work between contractions.
You'd have to work between contractions, but you can do it. You can do it. With the fast methods of hypnosis, you can say, I've got to help you right away. Close your eyes. Pretend you can't open them. Now the next contraction will be a lot easier for you. And they'll get easier with each contraction if you keep on pretending you can't open your eyes. Pretend with all your might now so that this next one will be easy. And you've helped that first contraction after that one. And you can do it within the 30 seconds. These are just some fast ways of working, that's all. Yes, doctor?
Economic closure and relaxation, you have the trance state.
Mm-hmm.
You can work and get rid of headaches and things of that sort. It's very nice.
Oh, yes.
Now, what is the advantage of adding somnambulism onto basic trance?
Oh, doctor, it's just the difference between day and night. The light state will enable you to give simple help. The deep state enables you to do things that are just like magic. Until you've worked with a deep state a while, you don't realize the difference. But there'll come a time shortly where you won't even bother with a light state. The deep state is so much the to be preferred state. Let's find out from an old student how often he uses the light state as opposed to the deep state. Doctor, which would you say, the deep or the light for you?
Well,
Deep. Deep. And do you ever use the light at all?
sometimes I don't get
Oh, yeah, yeah. Well, there's an answer. When he can't get the deep, he uses the light. He uses the best he can, which is the right way for the man to work. But It's seldom that you can't get the deep, Doctor. If you practice, you will reach the point where you will seldom fail.
You told the other doctor that you can't get the child's attention. Why, you can't go beyond that point. I think there are many adults you just can't get their attention.
That's true. For instance...
I haven't been unable to.
Yes, and I think that's true, because there are many brats who grow up to adulthood. And they're brats even though they're adults. And if you can't reach them, you can't reach them, and I don't know how to do it any more than you do. Yes, Doctor?
Now, for relief of, say, post-operative pain, you get them in the somnambulistic state, and they feel better, and you go back the next morning, and they're hurting again. You just repeat it, or...
Yes, yes. Say you lost your relaxation. Something happened last night. You must have had some bad dreams or something, and you just lost that relaxation. Let's get that relaxation back so that you get rid of that discomfort. Those tensions came right back, and when the tensions came back, so did the discomfort. Now, let's get rid of the discomfort as we did yesterday, and hold on to this relaxation. And you'll find that they'll hold on longer and longer. For example,